Okay, now we're moving on to the Smallify Advance tab. Now, this is the tab that I probably spend the most amount of time in this entire smile simulation software. It's because this is where we start to really dial in on the teeth. It's just like when you were in dental school in your lab, you would actually sit down and wax each individual tooth and trying to do a wax up. Well, this is kind of similar to what we're going to be doing. Although it's not a three-dimensional wax up, it's a 2D wax up, or at least a simulation. This is where I think you're going to spend a lot more time kind of dialing this in to get a more realistic idea of where this case could be going. So if we take a look at the height and width changes, if you're going to go through each tooth, know that when you adjust the height, it's going to change the gingival. So let's just pick the central. If I increase the height, watch, the gum line is going up and up and up, but the incisal edge stays right where it is. Same thing when you do the width, you're going to notice that the mesial is what moves. It's the distal that stays put. So when you are trying to adjust these teeth, and again, you can move this frame around, you want to set the incisal and the distal desired position. You want that set first. Then you can make any adjustments beyond that. And I'll always like to have the gum line of my proposed teeth be where the gum line really is, unless the patient's going to have some sort of gingivectomy or crown lengthening. I don't want to show a patient a crown or a veneer or some kind of porcelain work where it's going above the gum line. If there hasn't been talked about yet the idea of any kind of gum surgery, if they're opposed to gum surgery, then know that you can't show them an example of a smile simulation that shows gums out of the way. So you have to make sure that what you're doing here with a simulation is going to match up with what you're going to actually do clinically. So if we go through each one of these teeth, and this can be a little time consuming, so I'm not going to spend time on each one of these teeth. I'll probably skip through this when I go to the next one to kind of show you guys the end result. But I'll just make changes to the centrals first to kind of get those guys the right size. And I'll just be kind of working with the height, the width, making sure the incisal edge is just right. Again, I may zoom in even more to get more detail. You can see the quality of the photograph really helps a lot when you're trying to do these. The further you can zoom in and the more clarity you have, the better it's going to be. So as a side note, when they talk about being able to take a picture with an iPhone, of course, when saying a reason, the newest generation of iPhone is going to be your best pictures you can get. In my office, we use both an iPhone or we may use a Canon DSLR camera. And there's a few more steps in order to get that picture into the system, but I find that it yields a much better result. Okay, let's go over here to the, oops, sorry, that was still highlighted. Okay, let's move over here to this canine because you can see that's clearly out of position. Again, I want to set the incisal. Her lip is covering the incisal edge. So I'm not going to just move the tip of the canine there. I'm going to move the tip to where it really is. Because remember, when we mark the lip, that part will be cut off of the simulation. So I'm going to put this tooth in its right kind of bodily position of where it should be. And then I'm going to make changes again. I'm going to play around with the width, play around with the height to some degree, and get it kind of just the way I want. Same thing here. I can tell that right now, if I'm going to set the incisal edge, that's about right, but I think it's extending onto the gums just a little bit too much. So I'm going to bring that down slightly. Go over here to this lateral. Again, set the incisal and set the distal right where I want it to be. Okay, now I'm going to make it a little skinnier by drawing in that mesial. Okay. If you notice also this, watch this lateral, this wall right there. If I were to end it right there, there'd be a gap between the two. I would like for it to just be butted up right against it. But if I need to slide it, I'd rather slide the mesial of the distal tooth behind the distal of the mesial tooth, if that makes sense. So in this case, I want to slide this lateral, which is behind or distal to the central. I want to slide that in behind, and I'd rather tuck that simulated tooth underneath that, so to speak. Okay. And then this canine here again. Oh, sorry, I didn't highlight it. There we go. Now that's highlighted. Move this down, move it into position. Okay. Looks like it might need to be rotated. Look at this line right here is different than the gingival line. So here we can start doing some rotations. And I would say be very careful when you do rotations because that can really throw off the smile if it's off by just a little. So I'm going to make some rotations there just slightly to get that gum line to match up with the simulated one to work with. Now, as a side note, Smallify used to be called the DSD app, and they had some other features with it. You could actually take this rectangular box and you can distort it and move it in different directions. They've taken that feature away, so now you just have to kind of work with what they have, and it's still it gets it pretty close to where it should be. And that looks like it's pretty close right there. Okay. So now let's move down here. Oh, I'm sorry. I'm going to talk about this for a moment. If we were going to try to change the rotation of these teeth, you want to click on this thing called facial flow. Okay, this is going to kind of show these main points here to kind of get an idea of how the face generally flows. And you want to make sure that the teeth are in alignment with the face. If the face is kind of going this way and the teeth are going that way, it's just not going to look right. So if this person's facial flow, which is pretty symmetrical, is like this, and just let's decide for a moment if we're going to make any rotations to the essential, oops, sorry, move that one, make any changes to these teeth, well, we got to make sure that this red line is a good guide. We would hate to take these centrals and start to tip them too far away from that line. We want to make sure that those teeth are generally in line with the patient's main theme of however their face is flowing. Okay, so let's turn that off. Again, remember I talked about the marking of the lip? This is where it comes in handy. Again, you can kind of slide these things around. Remember I said that that canine is going to be tucking underneath that lip. So I want to make sure that, that lip is pretty accurate right in that spot. Also want to make sure that that's good right there. I'm going to pull this one back. I kind of exaggerated that motion. But I want to make sure that this proposed smile design is going to fit in here. So let me zoom out. I'm going to take this node, move it along here, and move this along here just so I can make sure that this simulated cusp tip of the canine is going to be true or look pretty true. Well, I might have to draw some more over here. They also have in the old software, you could add additional nodes. You can't do that here. That would be very helpful, especially when you get to some of these cases where you start running thin on some of these nodes. But you can kind of bring some over from the upper if it helps in making this smile look better. So again, so marking of the lip is both the upper lip, lower lip, to make sure that the area you've got cut out is going to have where the simulation is going to fit within. So upper lip, lower lip, very important. Okay, I think we got that pretty good. I don't think that's going to interfere at all. That's going to be great. Okay, so we marked the lip. Fantastic. Let's go switch it to colors. Let's see how we're looking right now. Okay. Again, don't look at the color yet. We haven't gotten to that part of it. I save color to the end. But now we kind of have an idea of what the general shape and frame is. And that's looking pretty good. Okay. So that's going to take care of it for that. And now the next video is going to be on color.